Hello, I'd like to talk with you today about functional medicine. For those of you who are not familiar with functional medicine is a new paradigm for understanding and treating the common chronic diseases that we encounter on a daily basis, such as hypertension, obesity, diabetes, depression, and others. It allows you to get to the root causes of a patient's symptoms. The current mainstream medical model is based upon utilizing only two tools found in the modern doctor's proverbial black bag, the scalpel and pharmacologic drugs. Unfortunately, both drugs and the scalpel are double-edged swords and come with the potential for many unwanted and potentially dangerous side effects. A functional medicine approach is personalized. It takes into account biochemical individuality. It starts by having the person tell their story of how they got sick, which requires time and very careful listening skills to look for underlying triggers and mediators which contribute to suboptimal function. Fortunately, the body has an innate intelligence and can self-heal when given the proper environment. However, there are unseen forces that act within the body on both a nutritional and biochemical level that can only be seen with advanced laboratory testing. Just as I would embark on a trip without a map and a compass, I wouldn't think about treating a complex patient without advanced functional laboratory testing. The map to help me on this journey is a new textbook put out by Metametrix called Laboratory Evaluations for Integrative and Functional Medicine by Richard Lord and Alexander Braley. And the compass to guide me in the diagnosis and treatment of complex patients is the cutting-edge biochemical testing which is done by Metametrix Laboratory. For example, the Comprehensive Organics Profile looks at markers of both fatty acid metabolism, carbohydrate metabolism, essential amino acids, markers of oxidative stress, markers of ATP production, and others to see what might be contributing to a patient's symptoms. This type of laboratory testing can also allow you to look at a patient's nutritional and biochemical terrain to see what direction their health is headed. I always tell patients that heart disease and diabetes don't just suddenly appear overnight, but rather years before these develop, we can spot abnormal biochemical patterns. All too often I see patients who have had testing done by mainstream labs with no significant findings. Yet despite this, the patient isn't feeling well. Something isn't just going right. For example, when I first began to use the organics profile that Metametrix offers, I saw an older gentleman and he told me, quote, "My life had come to an end." After he was hospitalized for a heart arrhythmia, he was placed on high-dose Zocor along with amiodarone. He said he felt weak, tired, and depressed. He had been seen at a large specialty hospital and was treated by several cardiologists. All of his usual blood tests were unremarkable. In going over his history, his problems started after he was hospitalized and he was placed on his medications. I remembered about the potential for a drug-drug interaction between Zocor and amiodarone. So I did an organics profile on him and it lit up like a Christmas tree, with all of his Krebs cycle organic acids being elevated despite having a normal CPK level. What I was seeing in the organics profile confirmed my clinical suspicion that he had poisoned his mitochondria, and this had been missed by the cardiologist because the patient didn't have clinical rhabdomyolysis. However, through the lens of functional medicine, along with using the organics comprehensive profile, I had solid evidence that the statin medication combined with amiodarone had poisoned his mitochondria and was causing him to feel so fatigued. Fortunately, I was able to explain to the patient that what was happening to him in terms of his fatigue and his depression was not in his head or simply because he was 72 years old. This is but one example of how the testing that Metametrix Laboratory offers can help you uncover both metabolic and nutritional abnormalities that simply aren't available with routine laboratory testing. I often make the analogy that being sick is like being on a dark street at night and losing a quarter. If you go to the other side of the street just because there's a street light there, you'll never find your lost quarter. Likewise, if you don't utilize functional medical testing, you don't really know what's happening in the body that's causing a patient's symptoms. I look forward to speaking with you more on how you too can utilize advanced medical testing which Metametrix has to offer to help you help your patients. Thank you.